Hello, today is November 15th and my patient is 223344. It's a 30-year-old female and the chief complaint is they do not want to get cavities. So today my patient presents for nutritional counseling. So hello there, my name is Abby. I'm going to be your dental hygienist today. And thank you so much for filling out the 5-day dietary journal. So what we're going to do today is we're just going to go through that, and then I'll be bringing attention any sort of like hidden sugars, and then also just educate on the cavity process and how the foods that we eat actually put you at a higher risk for developing cavities. So we've already reviewed the medical, dental, and social history, and it looks like there's been no changes there, which is awesome. You're still not taking any medications or have any medical conditions, and then no known allergies. And currently brushing 2 times a day with a manual toothbrush and fluoridated toothpaste, and then flossing maybe a couple times a week. I would really recommend, we'll talk about this more, but using a electric toothbrush because that just moves at a higher frequency than our manual toothbrushes do. So you can get a lot more work done and a lot more debris removed from your teeth and just a lot less work for you. And then it's also great because they have timers built in, so then you know that you're actually brushing for 2 minutes a day, which I know with manual toothbrushes, sometimes you just have to kind of guess unless you set a timer. I know when I used one, I was probably only brushing for maybe a minute, and then I wasn't reaching all the areas of my mouth as well. So we just conducted your extraoral and intraoral examinations, and everything looked great there. I did not see any signs of a nutritional deficiency because those can sometimes show up on our skin or also in our mouths. So the purpose of today's dietary analysis is just bringing the attention to how our diet and the foods we eat can actually really affect our oral health. And so we're going to be evaluating your diet, look for any nutritional deficiencies, and then see if there's any changes that we can make to your diet to help keep your mouth healthy and also prevent cavities. So what we're going to do is we're going to be looking at foods you eat that can put you at a higher risk of developing cavities. So the main ones we're going to be looking for are hidden sugars, which we'll talk about more in a bit, and then also fermentable carbohydrates. So that's just really like processed carbs and starches, as well as sugar. So those are the 2 main food groups that really promote cavities in our mouth and help they break down the tooth surface. And then we're also going to be looking at the frequency and the amount of sugars and carbs that you're eating, because that also plays a part in the cavity process. So yeah, just overall, we're going to be working together as a team to really just go through this dietary analysis and also make some goals for yourself that we can check back at the next appointment and see how they're working for you. So here with my Canberra chart, we just went through this, and this chart, it really just lays out a bunch of factors that can put someone at a higher or lower risk of developing cavities. So I did put you at a low cavity risk because you get daily fluoride exposure through your toothpaste, and you do drink sugar-free Red Bulls occasionally throughout the week, but you do drink them at meal times and you're not sipping them throughout the day. So that's awesome. And then also you haven't had any new cavities in the last 3 years. So for those reasons, I did put you at a low cavity risk. And then we've also just, we applied the disclosing solution on your teeth. So what that does, I'll hand you a mirror here. All of those pink areas on your teeth are plaque and buildup that may be being missed throughout your brushing and flossing. And through that, we calculate your plaque index score. So what that is, it's really just a percentage of all the surfaces of your teeth that have plaque on them. So for your plaque score, we have 20%, which is really not bad. It ranges from 0 to 100%. And so it's a good score, but there is still room for improvement. Another nice measurable goal that we could make for next time is to decrease your plaque score by 5%, and that's something that we can measure at your next appointment. Overall, you do have a pretty great diet. Going through your 5-day chart here, I didn't see any signs of a nutritional deficiency or malnutrition, which is awesome. At your meal times, you generally, like for dinner, you generally eat a protein, a carb, and then some sort of vegetable. And then I've found that you do have usually 2 servings of fruit per day. So that's really great. Overall, a pattern that I'm kind of seeing is that you do consume quite a bit of carbohydrates throughout the day in your meals. And then usually sometimes some type of like sweet treat throughout the day too. And just as we kind of already mentioned, those 2 things can increase the risk of developing cavities. I've highlighted any foods that are cariogenic. So what cariogenic foods are, it just means that they're foods that put you at a higher risk of developing cavities. So like we kind of said, it's the carbs and the sugars. And then I've also highlighted in red any hidden sugars. So hidden sugars are really important to be aware of because we eat a lot of things that we don't think have any sugar in them, but then they actually do. Like you would think having some salad dressing, but then it can also have 12 grams of sugar in it that you weren't expecting, So just from your foods, you had a banana those have about 16.6 grams of sugar in them, and then a Twix, which has about 19.6 grams of sugar. You had those, not every day, but you had a banana every day, but then the Twix was like every other day. And these foods have a certain consistency, so bananas are a soft solid, and then the Twix are hard and sticky. So these 2 foods, they're easily retained in like the grooves in your teeth, so like in your back teeth, like your molars. So we'll talk about some of the foods that you eat that you wouldn't expect to have sugars in them, but they do have hidden sugars. And so one example is a Thousand Island dressing, and then you also had a pasta salad with vegetables and Italian dressing. And here it looks like the Thousand Island dressing has 12 grams of sugar, and then the pasta salad with Italian had 18.8 grams of sugar. And so those ones are just kind of surprising because it's like most people, when they're having salad dressing, they just don't think that they're going to be consuming a bunch of sugar with it as well. And looks like you did have honey one day, and that did have 82.1 grams of sugar. So for stuff like that, if you are using it as a sweetener, I would recommend using a sugar substitute, or it's just something with not that high of a sugar content. And also you did have apples pretty often. So apples have, so like all fruits, they will have some sort of sugar in them. And they still aren't as bad as having added sugars like with processed foods. But with the apples, it did have 10.4 grams of sugar. But that is better consistency of a food for your teeth compared to bananas. So like bananas, very soft, they get stuck in your teeth. Apples are hard and crunchy, so they just don't retain as much in your teeth compared to bananas do. And then also we talked about the sugar-free Red Bull already. So you are drinking it in one sitting, which is awesome. I would just keep doing that compared to sipping it throughout the day. Even though it doesn't have sugar in it, carbonated beverages still put your mouth at risk for developing cavities because they make your mouth more acidic, which we'll talk about more in a second here. So when you're sipping it throughout the day, you're just constantly like putting your mouth in a state of acid, which we just don't want. So another big part of cavities is the frequency and the amount versus the amount of cariogenic foods that you're eating. So someone who has a high frequency throughout the day of eating cariogenic foods is at a higher risk of developing cavities than somebody who eats them just in one sitting. So, for example, if when we do eat or drink cariogenic foods, we're lowering the pH of our mouths, which is just making them more acidic, which is exposing our teeth to acids. So that's why it's better to eat or drink these cariogenic foods and expose our teeth to acids only a few times a day, rather than frequently snacking or sipping on sugary beverages the entire day. Because as we kind of already talked about, you're putting your mouth in a constant state of acid compared to only like brief episodes of having the acid. And so it's important that we break it up and into like meal times instead of having a high frequency all day, because when we do that, if we're snacking or sipping all day, our teeth don't have the ability to like remineralize and strengthen between the meal times. A little chart here that just is going to go over really the cavity process and how the foods tie into that. So there are 4 factors in the cavity process, which are microorganisms, a cariogenic diet, salivary factors, and then the actual tooth resistance. So cavities are formed when there is a cavity-forming bacteria on the teeth. And then when we eat sugars or fermentable carbohydrates, it actually creates an acid on the teeth. So once the acid is on the teeth, then it does begin to break down the tooth surface if it is not removed daily. And so fluoride, which is in water, as your toothpaste has it. They also have it in mouthwashes. And then here at the dentist, we usually recommend a fluoride treatment every 6 months. So what that does, it just helps to strengthen our teeth, and it makes it harder for the acid to break down the teeth. And saliva also plays a factor in the cavity process. People with dry mouth are at a higher risk of developing cavities because saliva buffers the acids on the teeth, so they just make it less acidic. It also helps to supply minerals to the teeth, and it helps to maintain a neutral pH in the mouth compared to an acidic pH. So just some tips from the dietary analysis to help reduce the acid-forming bacteria on the teeth is to continue to brush once in the morning and then once at night. I also would really recommend an electric toothbrush for you as well. And so just brushing once in the morning and at night just helps to remove any acid and debris that is on our teeth. And especially at night, it's really important because our saliva is actually less active when we sleep. So as we talked about all those great mechanisms that saliva provides, so like buffering acid, supplying minerals, and washing away acid from our teeth, when we're sleeping, our saliva isn't as active. So that just makes it really important to brush at night to make sure we're getting all of those acids are off of our teeth. So then when we're sleeping at night, the acids aren't breaking down our tooth surface. And then I like to floss at night to get my flossing in once a day. And then I just feel really clean before I go to bed. And I know I get out any food and bacteria between my teeth. We agreed on a goal of trying to floss every other day instead of maybe a couple times a week. So something to help you with that one, I like to put floss picks by my bed just so then I can see it before I go to bed and be like, okay, I need to floss. So I would really recommend you to try that out and see if it does help you with the flossing every other day. So we're going to start out with this small goal, and then hopefully next time we come back, you'll start to build a habit, and then we can get to a bigger goal of flossing once a day. Another really cool tip is to rinse your mouth with fluoridated water after meal times or when you're having a snack or after you're drinking like a Red Bull. This is just super helpful to really just rinse off the acid that just formed on our teeth. So, I'm not saying that you need to brush your teeth after every meal, but even just after you're done drinking a Red Bull, taking a little swish of water can really, really help just wash away any acid that's formed there. And then, you do eat very healthy with making sure you're getting your fruits and vegetables in. My recommendation is just to try snacking on more hard and fibrous fruits and vegetables. So, for example, continue eating the apples. And then I think it would be really helpful if you got one more serving of vegetables in a day. So I would recommend trying to like fit some carrots or broccoli in, because those are just those are really great vegetables for your teeth because they're really hard and they aren't going to be like staying stuck and staying on your tooth for the rest of the day. And another cool tip that I've learned since being in school is xylitol gum. So xylitol is a sugar substitute that is not consumed by the cavity-forming bacteria on our teeth. So if you have that after meal times, just another way to get off food and debris easily, but it is nice to have a gum that, isn't going to be causing cavities for you. And also, just another little tip, if you do eat cheese after you have sweets or at the end of the meal, it can actually prevent the production of acid in your mouth. So with your periodontal class, so that's just your gum disease class, I do have you at healthy because I don't have any signs of gingivitis or periodontal disease. And nutrition can also play into gum disease. So nutritional deficiencies don't necessarily cause gum disease, but malnutrition can contribute to the progression of gum disease symptoms and also be a factor in healing after treatment. So that's just making sure we're getting in lots of like vitamins and minerals and to make sure we're being healthy so that our healing process can be at a good rate. Thank you so much for doing this dietary analysis with me. I hope you learned a lot of stuff today, and I was really happy we were able to make quite a few goals for you that I hope we can stick to, and we'll check back at your next appointment, just see how they're working for you, if we need to make any changes or any tweaks to anything to make it more suitable for your lifestyle. And so we'll document in the patient's chart the rationale for the dietary analysis, which was the patient was worried about getting cavities, and also document what we talked about, the education provided, and then the goals that the patient will be working on that we can measure at our next appointment.